Namaste and good afternoon. Greetings from all of us at Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. Apollo Hospitals, as you know, has always been at the forefront in creating health awareness. And with our live sessions on Facebook, we have been bringing to you authentic information on diseases, path-breaking treatments, latest technologies, and medical innovations. Today, I'm delighted to welcome you to a very special session, Understanding the Role and Benefits of Preventive Healthcare. For many of you, for many of us even, a visit to the doctor happens only when you're sick. But do you know that preventive healthcare can actually save your life? Preventive healthcare includes health checks, counseling, screening, and it helps to detect illnesses early and even prevent them by detecting health-related problems beforehand, so you get a better chance of recovery. We all want to lead a very healthy and long life, so the best way to do that is through preventive healthcare. And the idea is to catch any disease early, which is the best way really to prevent and detect and treat diseases, especially those that don't show many symptoms early, such as diabetes or cancer or even mental health. Apollo Hospitals has been the pioneer in India in designing and implementing the age-appropriate health checks that are perfectly planned to screen for a number of health conditions in a very cost and time-effective manner. To explain this whole concept of preventive healthcare to us in greater detail, I am delighted to welcome Dr. Vaishali Lokhande. Dr. Vaishali is a consultant in internal medicine at Apollo Hospitals, Navi Mumbai. She comes with an experience of over 14 years in this field, and her areas of special interest are diabetes and rheumatology. Dr. Vaishali completed her MBBS from the King Edward Memorial Hospital and the DNB from the National Board of Examinations, New Delhi in 2003. She holds the following certifications and memberships: Life Member Association, Life Member of the Association of Physicians of India. She's a Life Member of API India, Life Member of the Maharashtra Association of Physicians, and has also done a certificate course in 2D Echo from the Glenmark Cardiac Center, Mumbai. Welcome, Dr. Vaishali Lokhande. It's lovely to have you at our Facebook Live session. Thank you so much for joining.
Namaste. Thank you.
So today our discussion is about preventive healthcare. So maybe we can begin by talking about what exactly is preventive healthcare and what is the spectrum, what all does it encompass?
So as you rightly said that we all visit a doctor when we are unwell, but there's this thing called preventive medicine. See, it's always good to avoid the cause that happen in the future. Assume somebody you know has been doing well, lands up with a collapse on the treadmill. We have seen many of the cases, absolutely healthy young people in their 40s collapsing on the treadmill. They probably had a heart condition which was not picked up. So if that person survives the episode, I still feel it is worth the money spent. But what if he cannot make it back home? So this is some tragedy which could have been averted had that person been probably to a healthcare setup where he could go for a health checkup. So it's like fireproofing your system. You don't wait for the fire and then you start pouring water all over. It's a way of fireproofing or an insurance against calamities in the future. So what these health checkups do is basically screen the person involved for a list of conditions which are common in that age and gender. And if the person has a risk profile, let's say there's a family history of sudden deaths or a family history of cancers, screen categorically for those in a particular manner so as to be able to pick them up early. We all understand and know that if there are cancers which are picked up in the early stages, they could be cured completely with resection and maybe local radiation or something of that sort. And when the person presents a bit too late because of the symptoms, when the symptoms begin, then we know that we've lost the bus, the flight, and everything. So in such cases, preventive health checkups definitely have a role to play. I'm tempted to give two examples over here. We have picked up in our Apollo Navi Mumbai 2 cases in the health checkups, which I remember because they were really a different turn of events. One was a breast CA, a breast cancer picked up on a routine mammogram. That woman was sent by her friends as a health checkup gift, and it picked up to be a breast malignancy, and it was operated, and she's doing fine 3 years down the line. Another one was a patient who had come because his son was worried about him. He was just feeling a mild fatigue. He turned out to be anemia, hepatitis C, cirrhosis. We started him on the right therapy. He got the antivirals and then he kind of, settled eventually. So these things, if these people had progressed to the last stage of cancer or to the level of cirrhosis, they would not have ever made it. So I feel health checkups do have a role in our health medicine. Definitely.
So, what is basically is preventive healthcare? If supposing like we're telling people that you've got to take care of your health, so there are many aspects to it. So one such is the screening and undergoing the health check. So we'll first talk about that. So what do you think? I mean, what would you advise people? When should they start doing, and what tests should they do? Because we also know that sometimes people think that why should I just go and do so many tests? Which ones should I do? Or sometimes they opt for some kind of a cheaper package where we get messages all the time saying that we do 100 tests for very but I think that we need to explain to people what is the right way to do a screening, because there can also not be that sense of complacency that comes out of just doing a few tests and saying yeah, everything is fine.
Okay, that's a very common scenario that you mentioned and a common problem that we as doctors face when people come with packages of 20, 25 reports in their hand. And see, so what happens is people are tempted, they are worried, they are cautious, but doing the tests, not understanding them, not interpreting them, and not taking action on them has no meaning unless you follow it up. So people do have blood tests as a maybe offers from some private setups, and they just keep those reports in the file, and then they follow up with the doctor later with some problem, and oh doctor, I had this issue and I never followed up. So a health checkup should not only include testing for particular illnesses, it will require evaluation by a clinician who is experienced in health checkups, evaluation for screening for malignancies or high risk conditions. The person will require good amount of counseling based on what his or her risk profile is, and further advice regarding follow-up. It is not a one point in time thing that you should think of as health checkups. It is a bond that happens over time and should build up over time and carry on forward. So you should look at something like at least few years. And let's say we think that a person is doing fine, but the BMI is 29, 30, 31. So they are following in the obesity category. We don't wait for their the lipid parameters or their sugars or their kidney function, liver function to go haywire and then act upon it. So all these things, lifestyle advice, dietary advice, modifications in their medications if they need any, and advising the right screening after that. So health checkup will not only include testing, maybe blood test and imaging, but also evaluation by a physician experienced in it, and guiding and hand-holding the patient further, or not the patient, the person further, to be able to lead a productive life fully and basically avoid his or her trips to the hospital in emergencies. It should happen that, they should be minimizing their healthcare costs. So besides screening, these things are required. Some of them you could offer packages. So these blood tests by themselves may not be enough. You may require some tools based on that. So there are some, like at Apollo, we have health checkups with some risk screening questionnaires. Those tools automatically populate all the data and you get the risk profile of the person, like let's say stroke risk or a cardiac risk. So all these things come with units or centers which have experience and millions of data that they have. Based on that, they have created this data. So those places, I think, are the best suited ones for a person seeking to go for health checkups. That's most important, I believe.
Yes, that is really such a valid point, doctor, because I think that medical input and that medical expertise, the doctor examining, is so much more important than just going to a lab and getting tests done. So that's absolutely right. So you were saying about a few cases where the disease was detected early and thus reversed and treated. So generally, do outcomes of various diseases, are they better when they are being picked up early? And why should you give some more examples also you can give about why diseases need to be picked up early?
Okay, so coming back to the same old adage, a stitch in time saves nine, is very much true in preventive medicine. So, again, let me go back to the first example. We have heard many fit runners, or like we heard about some actors who were in their 40s who collapsed on the treadmill. So these people, when you are embarking, and people are into this fitness and looking good mode nowadays. They go on a total on the highway, running on the treadmill, gymming, pumping up proteins, and doing weightlifting without any prior advice. So these people, not all may have a problem, but some of them could be having a condition called hypertrophic cardiomyopathy, where the heart musculature is enlarged. There is a problem with the outflow of the blood. And these people, when they go into extreme heavy blood pressure situations, when they're lifting weights, the BP can shoot up drastically, and they can have an episode where the rhythm goes haywire and the heart can actually stop. So hypertrophic cardiomyopathy is one condition which may not be symptomatic in the beginning. If the person has a history of sudden deaths in the family, or if they are embarking on a serious exercise program meant for some reasons, it's a good idea to see the physician or the local health setup where they're offering a good health checkup. A 2D echo screening in such cases, a good history taken by a good clinician, and if required, a stress test under guided conditions would be a good idea to do to rule out these conditions. Yeah, so this is one example. Other thing would be, again, cancer screening. I think despite so many years of information, we are still having a woman dying of cervical cancer. There's so much of vaccines available, but still, the point is that the screening helps in preventing these unfortunate events in the future. And heart disease is still the number one. We have, in fact, seen so many patients having positive treadmill tests reports. And when they have seen the cardiologist, again, the cardiologist has spent time with the person, taken a good history, correlated the history with the stress test findings, and angiograms have revealed actually blockages which are significant, which could probably, had they had a rise in the blood pressure or some sudden stressful situation, it could probably have caused a total coronary occlusion. So again, these are the ones I feel, once you have a myocardial infarction, like a heart attack for layman terms, these people, the heart muscle that is damaged because of this heart attack does not recover or regenerate. So that muscle or tissue lost, that time lost is lost forever. And you may, probably the person may end up in the cath lab, they may undergo an angiography, angioplasty, but the dead muscle does not recover. The pumping capacity is compromised, remains at that compromised level only. Had this been evaluated in the right profile person, probably we would have prevented that heart attack if the selection is right. You don't do it. It is not supposed to be indiscriminate and random. It has to be systematic. That is where the human touch comes. It's not totally artificial intelligence here. There are clinicians who have to understand this, guide the person, and then maybe advise for the evaluation. So these are two things I really have noticed a lot of positive impact in these patients. And of course, diabetes related again. So that's one area where health checkups do help a lot.
Yes, indeed. So what is the right age for somebody to start having these health checks? Because now we have, even for teenagers, and we have different age appropriate ones, but I think a common doubt is, when should I actually make an annual ritual of going and getting that health check done?
Yeah, that's a very tricky one to answer. But if you ask me frankly, anybody above the age of 35 is valid enough to start doing their health checkups. Maybe up to their 40s or 45, they could do it one every 2 or 3 years based on their profile. If something comes up in the health profile, then definitely do it more frequently as per the physician's advice. Teenagers, we feel that, come on, why should the younger generation go for it? But we have seen a lot of obesity. We have seen heart conditions in young population, though of course the percentage is not so much. I'm not a pediatrician practicing, but I understand that I've seen 16 and 18-year-olds coming with the health checkup packages. So supposing some families have a history of heart issues or cancers, those people should definitely be encouraged to go for health checkups at the right time. And then maybe you could plan a screening program for them every 3 or 5 years based on what the risk profile of that family is. Otherwise, the general population, definitely above 35, I would suggest doing it every 3 years, and after 40 or 45, every 1 year positive.
Absolutely. So the next thing is about the different, we have both the age appropriate ones in our Apollo system, and then we also have gender based. So that brings us to the issue of the women's health checks. So this again is something which many women keep asking, like, when should I start having a pap smear, or when should I do a mammogram? Because one hears that, like, breast cancers being found in younger people. So what is your advice regarding women's health checks?
Okay, so pap smear, see, any woman who's sexually active can undergo a pap smear examination as a part of screening. But again, we are a resource poor country. Not all of us really have the means or resource to do it. So again, any woman above the age of 35, ideally, there is no harm in doing a pap smear every 3 years. Or after, for mammogram, again, breast cancer history in the family, either in the mother or sister or immediate cousins, that's a first degree relative with breast cancer. As soon as if there's a history available, they could go undergo a sonomammogram if they are below the age of 40. Above the age of 40, extramammogram is a reasonable screening tool because we don't do radiation-based test before the age of 40. And after that, based on the profile, supposing it's a strong family history, more than one relative affected, a yearly mammogram is definitely a good idea, accompanied by a clinical examination by a gynecologist or a general surgeon who's involved in breast management. And otherwise, it is based on their profile. Every 3 years is a good enough idea if they don't have any risk profile and they're doing fine.
And coming to the organ specific checks that need to be done. So let's first talk about the heart. So we have a plethora of tests starting from blood parameters. There are echo and ECG and stress test and right up to the CT angiogram or even a regular angiogram. So for a person who's just starting off screening, will the tests that they need to take depend on their for example, their obesity or their family history? Or is it that when they start off, it should just be some basic investigations?
I think once you're starting at the age of 35, maybe let's say a person is willing for doing it, then a basic eco TMT won't harm much because if we are doing this curative practice that we all physicians are dealing with, we are seeing a lot of people coming with hypertension and diabetes even before 35. So why wait till 40 and 45 for the problems to happen and then start investigating? So we are seeing people who are average population is overweight right now or in the obesity category. Most of them have stressful lifestyles. If they have nothing else, at least they are stressed about their jobs and their sleep patterns are poor. All of this definitely has a toll. So at the age of 35, you're starting a basic screening would include a lipid profile, thyroid evaluation based on the person's gender, at least in the woman it should be done, HbA1c, basic LFT, RFT screening like SGPT and creatinine at least, and ECG. And if the person, you could offer either echo or TMT. So maybe the first time do an echo because you want to be sure that the heart structure is in order. You're not subjecting somebody with a high risk condition to a stress test without evaluation. Once he or she has done that, maybe the next time they appear for their health checkups, say after 2 or 3 years, then they could go for regular TMTs and based on the symptoms, maybe add to the list, maybe modify it a bit and curate accordingly.
So when it comes to liver and other gastrointestinal issues, so we know that now there is a lot of non-alcoholic fatty liver disease among many people. So, and also of course the hepatitis and other gastrointestinal conditions, a lot of people with inflammatory bowel conditions as well. So what are the basic screening tests and what are the advanced tests that you do for this system?
So for liver function evaluation, the basic test would be a basic LFT, which would include the liver enzymes, serum albumin, your protein ratio, and CBC, because you need to know what the platelet counts and the HB is like. You would want to do the renal function if the liver function is deranged. So it is not like you do one organ, you do only that test for that organ because things are interconnected.
Yeah.
If the person is obese, he or she may be having fatty liver disease because of diabetes. And so that's why you need to know the lipid profile, the HbA1c and the TSH. So even if this person says, I have come for a liver evaluation, it can't be an exclusion. The whole body is a unit. So still a TSH or lipid profile HbA1c is a good idea. And of course, if there's a specific concern, then doing vital markers like hepatitis B and C, an ultrasound screening by a good radiologist. And if there is some evidence of fatty liver, doing a elastogram for looking for the your fibrosis or early fibroscan. That what I mean to say is a fibroscan would be a good idea. That is based on the person's ultrasound imaging report.
So at the end of it, I think it all boils down to this, that, it is better to follow a particular, like once you have a comprehensive health check booked in a hospital where, these things are carefully thought out and planned, and there is enough of medical expertise to also individually examine you. I think that should take care of things rather than worrying about which test and which organ and things like that, isn't it?
True.
Now, let's talk a little bit about another aspect, in a way, of these are largely covering the non-communicable diseases, but there is also another element of communicable diseases, and one way of preventing that is through immunizations. So do we also offer are there immunizations part of these health check programs, and how does one, I know that childhood vaccination is pretty much set for most people because they follow the card and they finish that, but what about adult vaccination? What aspect of prevention does that cover?
So actually, adult vaccination is a very important area, neglected even by physicians across the
Yeah.
world. It's more of a mindset thing than, I think, knowledge issue. So we need to understand that we have seen enough COVID related morbidity mortality in the past 1 year to understand and underline the importance of vaccination. Having said that, at Apollo Health Checks also we have adult vaccination as a part of the health checkup program, where once the person has been seen and screened and seen by the physician, he or she is given the right age appropriate advice for vaccination based on the person's risk profile. Let's say for diabetics, any diabetic should be immunized with pneumococcal vaccine every 5 years. And of course, after the age of 65, you choose the right kind of vaccine, which valent it is, 23 or 13 valent. Second thing is everybody should get a flu shot if they are diabetics, COPD, smoker patients, or hypertensive or heart failure patients. So these things are again based on the person's profile. What about healthy young individuals who don't have any issues? They could still be offered flu shots based on their risk profile and their behavior, because most of them are into the community out. They do mingle with everybody. So the risk of getting infection, and we need to basically avoid complications because of infection. Not everybody suffers. So vaccinations are very much an important component of these health checkup programs which are offered. And in fact, I feel they are the best part of preventive medicine. Adults suffer more compared to children when they have an illness like chickenpox, because their immunity is not at all primed to this. So the complications, the morbidity, the hospital stay, and the costs involved really can be humongous. So in fact, I really feel your vaccination should be strongly advocated, which we do over here. It should be done very regularly for people of the right profile.
Also, one always says that, the preventive healthcare, like, sometimes people, also have this thing that, when we are fine, why should we spend money and, get these tests done? And maybe the hospital is just piling on more tests which are not needed. But at the same time, there is indisputably, we know that, it is definitely also quite cost effective for somebody to take charge of their health like that and proactively find and treat issues. So, could you explain a little more of these economic benefits of doing these health checks?
Okay, let's start with some analogy over here. Supposing you're driving on the highway, you've not serviced a car in the last 1 year, you've forgotten what it is like, and your car breaks down in the middle of nowhere, no phone network available. You try to hitchhike and then you get help after a few hours, and that person charges you a bomb, and you spent several hours. The important meeting you wanted to go for has been totally missed. So the cost, the mental stress, the agony that you suffered, I know it is painful then, but it is still nothing. Imagine the person is doing some activity and he or she has a collapse and there is a major heart attack, which could have been avoided. I'm just giving an analogy.
Yeah.
So these things could be avoided if you have probably been alert about it. If you know about it, you would act upon it. Supposing somebody knows that their LDL is 200, okay, and they are not having a discipline in their lifestyle, and they are still eating all the junk and the high trans fat stuff. Obviously, their plaque buildup is going to happen. Someday it's going to rupture when the BP shoots up. Somebody doesn't see a doctor at all or even a health checkup, and their BP is being 200 and 100. So definitely one day the shoe will fall. So we need to understand these things, that these kind of health checkups done in time, the amount spent on a health checkup, I mean, in terms of the time and the money, is definitely worth it, because it saves you a lot of headache, stress, the productivity that you lose, the income that you lose, and the mental agony and the peace of mind. So basically, you are trying to fireproof, as I reiterate again, and it's basically about leading full productive lives without visiting the healthcare settings for an acute emergency. I still will advocate health checkups very strongly for everybody who's listening to this.
Yet another aspect of prevention is lifestyle modification, which also stems from getting that health check done, because only then you find out what exactly is not perfect and then you work on how to improve it. So, would you like to tell us a little more about basic lifestyle modification tips which are needed, which is also an element of preventive healthcare?
Okay. So lifestyle is all about what you eat and what you do with your general health. So obviously the dietitian, we have lifestyle consultants at many setups over here, but we are what we eat. So a dietitian is the right, or nutritionist is the right person to guide us. But having said that, having the age appropriate and weight appropriate, gender appropriate calorie intake with the right amount of protein, carbohydrate and fat ratio, avoiding the foods that are going to cause more plaque buildup or cholesterol buildup. So all these things you may learn it from the internet, or you may search from the internet, but modifying that kind of calorie intake to your to a person's cultural setup, or to their food, like some people have food issues, some people have some food allergies. So all this adjustment is usually done by a person who's trained in nutrition. So a dietitian would guide in that, and of course exercise. So having calorie appropriate thing, but if you're not exercising, or if the person has hypertension or has diabetes, or they're pre-diabetic, then exercising in the right amount, like let's say 200 or 250 minutes per week aerobic activity, wherein there is a calorie burnout, and that helps in improving the insulin sensitivity. So it will improve the sugar levels eventually. So physical activity of some form, not just aerobic activity, but doing weight training, because we need to build up muscle. Unfortunately, Indians have a very poor muscle strength. Most of the Indian people who are diabetics tend to have very poor lower body muscle mass. That all adds to insulin resistance. So again, this all guidance is given by a person who's dealing with either a good physiotherapist or a yoga person who's attached to the this. We have our bariatric program where we had a good person who teaches yoga and right kind of exercises. So all this, it's a teamwork thing. A doctor can only give advice based on basic, like you give a prescription, 25 kilocalories per kg, maybe, exercise, aerobic activity, functional training or weight training, etc. But the elaborate part of it is given by the person experienced in that. So all this happens in a setup where you have the entire team available. So again, these things have to be incorporated. Just knowing your reports, not acting on them, really will not make any difference, and you'll again come back with more abnormal reports the next time.
Absolutely.
So those advices have to be followed.
Tobacco cessation and alcohol modification.
Yeah, definitely. So that I mean, again, I'm assuming that people will understand once they've seen a doctor for at least a health checkup, avoiding stuff like, so addictions. So these things are toxins basically. Alcohol, smoking, tobacco in any form, even sleep. We think sleep is not essential. Many people don't really bother about the sleep quality. Even ensuring adequate sleep quality is essential. So digital detox also is a part of all this lifestyle modifications. Meditation and yoga definitely have a major role to play in our lives, which are difficult to really imbibe with our time constraints. But yes, we must make time for all these.
Absolutely. Is there anything else that you would like to tell our viewers about preventive healthcare, Doctor?
We have seen really bad 1.5 to 2 years of the COVID pandemic. And in the beginning, it was only COVID and COVID everywhere. But eventually, the other illnesses have again started creeping up. People stayed indoors, but not for long. All that indoor stay and inactivity has made many people gain weight. All their sugars have gone through the roof. Their lifestyles have become more sedentary. And we're seeing more obesity in the last 1 or 2 years. COVID will eventually dissolve, or maybe settle, or it will become endemic and we'll adjust to it. But our lifestyle illnesses are not going to change anywhere. So let's take charge of our health. Let's make a new year resolution this year. Let's go for a health checkup, see the right place, right setting. And our resolutions usually are, I'll eat healthy, I'll exercise. But whether I know my parameters, do I know my numbers right? My blood pressure numbers, my sugar numbers, my lipid numbers. So let me know my numbers right. Let's make a new year resolution about this, and at least plan health checkups for ourselves and our family and our loved ones. Stay safe and stay healthy.
Thank you, Dr. Vaishali. So, as Dr. Vaishali said, don't take a chance. Get yourself screened annually. Make sure that no symptom is ignored, and do screen yourself, especially for the non-communicable diseases. Even if you have no symptoms, do take your vaccines, practice your preventive measures in your lifestyle in terms of what we discussed in terms of diet, fitness, or de-stressing, avoiding addictions, and also ensuring a good quality of sleep. You have just one life and one body, and it is priceless. So you please take good care of it. Please subscribe to all our social media channels, our YouTube channel, for latest information on trending healthcare topics. And if you have any queries, or would you like our assistance in any way, you know where to find us. We can be approached through our website and through our multiple apps and social media channels. Take care, be safe, be well. Thank you, and namaste.